The treatment of kidney stones depends on really where the kidney stones are located, either in the kidney, in the tube draining the kidney called the ureter or the bladder, and also on the size of the kidney stone and whether the kidney stone is causing symptoms or not. And that will determine the best form of treatment for that particular stone. Sometimes stones may be very small and can be managed conservatively with just some pain relief. Occasionally we need to proceed with treatment to break up that stone into smaller fragments that can then pass on their own. Kidney stones are often treated by a number of ways. One is by shockwave treatment, where a beam of sound waves are focused onto the kidney stone itself in order to break them up. And that's usually from an external source of the sound wave, and that's called extracorporeal shockwave lithotripsy. But sometimes when we need to get to the stone directly, we pass a telescope up towards the stone to break that stone up. We use there are two main methods to break the stone up. One is with something called a lithoclast, or a Swiss lithoclast. And that's a very simple method. It's like a jackhammer, where air pressure is forced onto a hammer that is connected to a metal rod that then is placed onto the stone itself. And the high pressure air forces the jackhammer back and forth, and that energy is transmitted to the rod, which is then transmitted directly to the stone to break the stone up. The other way of breaking the stone up is to use lasers, and the laser uses light energy, which is focused directly onto the stone, and then that light energy breaks the stone up. Holmium laser is the commonest laser that's used to break up kidney stones. It's a pulsed laser, so you have pulses of very high and light energy, and it's optical energy, and that holmium laser energy again is focused onto the stone and is used to break the stone into smaller fragments. And then those fragments can either, if they're very small, can be left to pass on their own. If they're still a reasonable size, then sometimes we put in a little, what we call a stone basket. It's a little wire basket up through the telescope to grab the stones, and then we retrieve the fragments out, but they're much smaller than the original size stone that would have been broken up by the holmium laser. So usually the laser kidney stone surgery is done as a day case procedure. So the patient's in just usually for half a day, maybe a day in hospital. Because there are no incisions, no cuts, the recovery is fairly quick. Most patients will be up and about the next day. What they might notice is some pain or discomfort from having the telescope passed and from passing some small fragments. They may notice some blood in the urine. And there is a risk of getting a urine infection afterwards. So we use some antibiotics to reduce that risk. But apart from that, the recovery is usually very quick. Yes, in general, it's very safe. It's a very commonly used way of treating kidney stones. The main risk, as I mentioned previously, the risk of having some blood in the urine, a risk of urine infection, which we try and reduce by giving antibiotics just at the start of the procedure. The other risk is of injuring the tube that the kidney stone is sitting in when we use the laser onto the stone itself. That can directly damage the tube itself. That's very rare, but if it does happen, it may require us to leave an internal drainage tube, which allows urine to bypass the area of damage to pass down into the bladder directly, allowing that area to heal. Very, very rarely that damage to the ureter requires surgical repair.